Well, welcome everybody to a very special edition, a very special series that is COVID-19 Wellness Series that is put together by Serve Canada, a great organization in association with ARRA Arts, another wonderful organization. Both these organizations have come together to put this COVID-19 Wellness Series in support of our frontline healthcare workers, in support of you. It's so crucial at this time when our mental, our physical health is so important, so important. And those around us as well. We have to take care of ourselves, we have to take care of those around us. And this series talks about a lot of that, brings in special guests, whether they're from the medical field or whether it's yoga or whatever it is. But it is all about our physical and mental health. Today we have two incredibly special guests with her that our host, who's going to be coming up very soon, will introduce. And this is also in support of Trillium Health Partners and the Trillium Health Partners Foundation, incredible organization consisting of 3 hospitals, the Credit Valley Hospital, the Mississauga Hospital, and the Queensway Hospital. They provide world-class healthcare right here in our backyard, and it's terrific that Serve Canada, in association with ARRA Arts, are putting this together in support of them. Now, without further ado, let me introduce you to the founder of ARRA Arts, as well as my wonderful host, the co-host of today's special series, and that is Anu Srivastava. Anu, welcome. Anu, before you start, I want you to speak about what was the impetus of starting this COVID-19 Wellness Series. I think, tell us why you decided to do this. Why did Serve Canada and ARRA Arts decide to come together to make this happen?
Definitely. Thank you, Jake, and welcome everyone to the COVID Wellness Series. Foremost, before I start, I'd like to bring greetings from Premier Doug Ford and Mayor Bonnie Crombie for endorsing and supporting the COVID-19 Wellness Series.
Thank you to Serve Canada, Trillium Health Partners, and ARRA Arts on the launch of the incredible initiative to highlight mental health and wellness. I know this pandemic has been tough for a lot of people, especially on their mental health. And the reality is that no one is immune to it. Everyone can sometimes experience burnout, depression, anxiety, and isolation. I hope that through this series, you can learn how to care and maintain your mental health. Your mental health is just as important as your physical health. Even though you may feel alone or helpless, I want you to know we have your back. If you need someone to talk to, please reach out to some of the amazing mental health and addiction agencies in your community. Thank you and God bless you.
Mayor Bonnie Crombie here from the great city of Mississauga, sending my best wishes to all the organizers and participants attending the COVID-19 Wellness Series hosted by Serve Canada and ARRA Arts in collaboration with Trillium Health Partners. COVID-19 pandemic has brought so many uncertainties to our lives and has disrupted our way of living. It's okay to not feel okay during these uncertain times. It's important to stay active and stay connected mentally, physically, emotionally, and spiritually. The COVID-19 Wellness Series is an opportunity for people to de-stress and take care of their mental health and well-being. By showing up at today's session, you are making your mental health a priority, and you should be very proud of yourself. Brighter days are ahead. In the meantime, stay healthy and stay safe.
Hello, my name is Nicole Lamont. I'm the Vice President of Philanthropy for Trillium Health Partners Foundation. It is my privilege to get to thank you for everything that you have done for Trillium. For those of you who may not be as familiar with Trillium, we are the hospital system that serves close to 2 million people across our Credit Valley Hospital site, Mississauga Hospital, and the Queensway Health Centre, right into West Toronto, through to Oakville, and north up to Milton and Georgetown. We have a very large catchment area and a very full offering of programs, including mental health, the largest in our region. We are so appreciative of your support of our COVID-19 Wellness Series. Your support is ensuring that patients and families have access to the mental health care supports that they need when they need it the most. We are just so appreciative. Thank you for your support. We also understand how much time and energy and dedication goes into organizing events like this, and I want to thank Anu Srivastava and your committee for everything that you have done. Thank you on behalf of the many people who will benefit from your time and your generosity. Have a wonderful event.
Well, We Serve Canada is a not-for-profit organization with the main mandate for that organization is health and wellness. And we Serve Canada collaborated with ARRA Arts, which is actually a social wellness organization. And the idea behind the thought of doing the COVID Wellness Series was that we were into a few months of the pandemic, and there seemed to be no end in sight. And people were going through very difficult times, and it became almost imperative that we, in the community, brought something together that would help our people how to take care of themselves. Whether it was the physical aspect of it, whether it was the mental or spiritual or emotional, but the most important thing that was required for all of us during these difficult times was self-care. And so it was the brainchild of these two organizations that decided to come up with the COVID Wellness Series. And they are going to be 10 virtual workshops. And what the idea with the virtual workshops was, again, to explore some common understandings and give some common insightful conversations through our medical experts, through our medical doctors on one hand, and our wellness experts on the other hand, the mental health people also on one hand, and explore some of our traditional and alternative methods as well, like yoga and meditation. So that's why you will see these series of 10 virtual workshops is going to be a combination of different medical specialists, wellness experts, and wellness enthusiasts. So without further ado, I'd like to welcome our very two esteemed panelists, and Dr. Jaya Chanchlani and Dr. Teena Chanchlani. Dr. Jaya Chanchlani has been running her family practice in Brampton for the past 30 years. Besides carrying out a very demanding medical career, she has always made the time for several worthy causes. She's actively involved in various community organizations and many boards. Dr. Chanchlani has helped and provided leadership to several large fundraising initiatives for the community organizations and the hospitals. She has played a really big role in her family's philanthropic initiatives through the Chanchlani Foundation. The foundation has focused philanthropic initiatives which revolve around education and global health research, and has supported the creation of the Research Center at McMaster University and the Rehab Center in India through University of Toronto. And now I'd like to introduce Dr. Teena Chanchlani, who practices family medicine and has completed her training in British Columbia. She's currently working in downtown Toronto and practicing both family medicine and walk-in. I'm delighted and privileged to welcome Dr. Jaya Chanchlani and Dr. Teena Chanchlani to the workshop. And here is the first question. I'll start off with Jaya. Dr. Jaya, how can patients prepare for their visits for the doctor's appointments?
Thank you, Anu, and thank you, Jake, for that introduction. So to answer your question, we started doing virtual appointments in March, which was just the start of pandemic at that time. And it started out like a safer option because we were not going out too much to our clinics. What is a virtual appointment? So it is a conversation between the doctor and the patient, which is done either as a telephone call or a video call, and usually it's from patient's home. So patients are at home, they don't have to go out, and they get all the information they need. Now, how is it done? So when the patient calls our office, our front staff has been trained to ask few screening questions, and then they decide whether we can manage this patient virtually or they need to come in. And so according to that, they give them an appointment. So the appointment for virtual appointments are given like as a window of maybe a couple of hours, and the doctor is going to call them back. And if it is face to face, then they come and see us like they always did. Now, why are we doing these virtual calls? It's because we cannot see as many patients as we used to see before. It's not possible. With social distancing, we don't want to overcrowd our waiting rooms, and we have to sanitize our examination rooms after every appointment. So it's kind of hard for us to see a number of patients. So if you see most of them, we see virtually, and then some of them who have to come, then we see them in the office. Now, who are the patients we can see virtually? So these are mental patients with skin problems. They can send us pictures on email, and we review them and get back to them. Travel advice. Hypertensive patients who are checking their blood pressures at home. Diabetic patients who are checking their blood sugars at home. And a lot of sinus infection, urinary tract infections we can manage on as a virtual appointment. And if somebody had a blood test or an X-ray or an ultrasound, we are still able to give them the report and discuss their case on the phone. Now, who do we have to see face to face? It's mostly neurological patients, patients with lacerations, abdominal pain. We have to see them in the office because we have to check them and order some more tests. Gynecologic problems, a lot of chronic heart and lung diseases. If they are stable, they are okay. But if they're getting worse, we have to get them in the office and see why are they getting worse? Are they going into failure? Pregnant patients, all the regular visits, all the baby and child immunizations we cannot postpone for too long, so we have to get them in. And also don't forget, adult immunizations are also as important, like tetanus shots, pneumonia shot, and allergy shots, and definitely flu shots in this season.
Thank you so much, Dr. Jaya. That has been very insightful and very detailed information that people can actually know that, if they have certain issues, whether they can expect a virtual or a phone call or an actual visit. Thank you. Thank you
Right.
for that. I'll head to the next question. It's more now that the fall season is here and the schools have started. And if, let's say, a parent thinks that the child is not well and they have some kind of symptoms, how and when can they actually go back to school?
For all parents, since school September, so what we ask is that children should be screened daily for symptoms of COVID. And there are two main groups of symptoms that we're looking at. We're looking at priority symptoms and secondary symptoms. Priority symptoms include fever over 37.8 degrees Celsius or 100 degrees Fahrenheit, cough that is new or worsening and not related to another known condition like asthma or allergies, shortness of breath, and a new decrease in loss or loss in sense of taste or smell. If your child has a priority symptom, they need to be kept home and isolated. If you choose to have your child tested, and they test negative, they can return to school after 24 hours of symptom improvement. If you choose not to have your child tested for whatever reason, then they do need to be isolated for 10 days and symptoms need to be improving for 24 hours before they can return back to school. If your child tests positive for COVID-19, public health will be in contact with you and advise you on how to proceed, but likely your child will need to be isolated for 10 days. Secondary symptoms, or less serious symptoms, include a sore throat, runny nose, headache, nausea, vomiting, diarrhea, fatigue, lethargy, and muscle aches. If your child only has one of these symptoms, they just need to be monitored and they can return to school after 24 hours of symptom improvement. If your child has two or more of these symptoms, then they should either be tested or isolated for 10 days and then there should be symptom improvement for 24 hours before they can return to school. In any case, whether your child is tested or has symptoms or is not tested, when they are ready to return to school, you will not need a doctor's note. You can sign a self-attestation form, which both the Ministry of Health and the Ontario Medical Association can provide to you through their website.
Dr. Tina, that is a wealth of information. I had no idea what the priority symptoms were and what the secondary symptoms were. So, no, thank you for that. Would you also have any advice for parents who have decided not to send their kids to school in September? Would you have any
Sure.
advice for that?
This is a bit of a trickier situation because each family does need to sort of look at their own risk factors for contracting COVID-19. And so it can be quite a personal choice. We do know that schools are hotbeds for infection, and many parents feel that each year their children pick up infection after infection, even in years prior to COVID-19. What I would suggest is if you have any concerns about sending your child to school, to talk to the school directly. The provincial mandate is that both children and teachers self-screen daily, but there are likely additional measures that your school is doing to prevent the spread of COVID-19. Sort of initiatives that we've seen are social distancing within classrooms, or are placing children in what they call pods. So this is a group of 3 or 4 children that are allowed to only socialize with the children within their pod. So each school is looking at their particular risk factors, their area, the way that they've organized work and play previously, the way they've organized work and play now, and picking up various measures to try and keep the children safe.
That's great. Jake, over to you.
Tina, thank you very much. That was very, very informative and some really detailed guidance, and that's awesome, especially for the parents. I want to ask a question of Dr. Jaya Chanchlani. The province, depending on how the cases are going, sometimes it opens, sometimes there's stricter measures put in, and certainly right now there's color coding. When the province does start to open, how do we engage?
Yeah, so it's very confusing, right? Like sometimes they open things and then this color coding and all that. But whenever the province will open, more and more people are going to go out, right? There's no doubt about that. So if they're going outdoors, then definitely it's safer because there's lots of ventilation and they can maintain the distance easily. The problem comes when they're going to go indoors. So if you're going to go indoors, there are some things you should consider before going. Now, to make it easy, you should remember 3 C's to avoid: closed spaces, crowded spaces, and close contact. So let me elaborate on that. So if you want to go somewhere, you really have to ask your question, like, should I really go? Do I have to go? And if the answer is yes, okay. How large is the space? How crowded is going to be? How many people are going to be there? Do I know most of them? Am I going to see a lot of new people? Because this is not the time and place to make new friends or see new people because you don't know where they're coming from. Once you reach the place, look for some proper ventilation. Is there any window which was closed and you should open it? Is there any door which could be left open? Are people wearing masks? Are they following the distance? Right? Like a lot of places you go and half the people are not maintaining the distance or wearing masks. The other thing which is how much time you want to spend. So the magic number is 15 minutes. Try not to spend more than 15 minutes with an individual. Now, 15 minutes, you might say, oh, I don't talk 15 minutes to anybody at a stretch, but it could be 5 minutes, 3 times is also considered 15 minutes. So to emphasize again, very simply, avoid closed spaces, crowded spaces, and close contact.
Very, very informative. Closed spaces, crowded spaces, and close contact.
Right.
The three C's.
Yes.
The 3 C's. And we can remember them with your last name, Chanchlani, with a C. Oh, Jake, stop it. That. Dr. Jay Chanchlani, you've been awesome, and thank you very much. And thank you to you and to Tina Chanchlani as well, both amazing doctors. And I think everybody knows the great work that you do in the field that you're in as medical professionals. But the work that the Chanchlani Foundation and you, Jaya, what you have done in the community is just It's truly exceptional, and we thank you for that. Folks, this concludes part one of the Let's Talk Health with our general medicine practitioners, Dr. Jaya and Tina Chanchlani. We're going to take a little break, and we'll be right back with part two of this amazing conversation. Be right back.